let's talk about stroke a little bit. And it kind of carries into the mutual patient that we had of like, I promised that I wouldn't get my neck adjusted. And you're like, well,
you have neck pain and headaches.
Yeah. It's like, yes. So I'll let you kind of touch on it.
Yeah. I mean, so like,
give us a place to start.
Yeah. Place to start. What, like when people are talking about, well, I heard chiropractors can, cause strokes. Okay. Sure. That's happened in the world before, but statistically, like what are the numbers? Like the first few studies that you'll pull up are basically like single case studies of this person had a stroke after getting adjusted. Well, is that like
causative?
Right. Is it a fair way to assess us as an industry?
Right.
No. And you can't isolate like through the studies, like study types, like a double-blind control study. You're never going to get that in the chiropractic industry. You're never going to get that in massage, PT, acu.
So it'd be more observational.
Yeah, it's observational. You take big data sets over time and you go, okay, here's all the people who had strokes. Here's who went and saw a chiropractor within certain time frames. And there are studies that show this. And so like those data, those research reviews, which is the best thing you can do with this type of industry, this type of therapy, is you look at a correlation, not causation. So there's no correlation from getting a chiro adjustment and having a stroke. There's data out there that suggests like whoever's having a stroke, if you see a chiropractor first or if you see a medical doctor first, those rates are statistically the same. They're not different at all.
Right.
And there's actually more evidence to show that.
Well, and to that point, like what are some of the symptoms of a stroke?
Oh yeah.
Neck pain, headache.
Oh, jeez.
Like
the first and worst, that's what we learn in school.
Yes. So like first headache
Ever.
like this, so that's one of the, questions like, hey, you have a headache. Have you had a headache like this before? And if they're like, no, I've never had one this bad like this before.
Right.
You're like, let's go somewhere.
I taste pennies for the first time.
Methinks this might not be the right day for
the
us.
The point is, like, that's probably the most common, and I don't know, like neck pain, headaches.
Yeah.
Those are the only two indicators of like vertebral basilar artery dissection.
Well, that's good.
Yeah.
Good job.
Did you learn that in
VBAs.
second grade too?
Yeah.
Yeah, second grade.
Yes. Thanks, Miss Larson.
That was sixth grade. But those like the predictors for that, like the spontaneous dissections of that. So like this guy right in here. Can you see that in the shot?
You can see it.
So
I'll
like,
zoom in on it.
Yeah, the artery goes up through these little holes here, and it takes a little angle and then goes back up. There's actually some anatomy that, like, if you saw it on an X-ray, you'd be like, yeah, if you're old and you have some neck stuff, we'd probably adjust this area differently. But like in general, this is what they're talking about.
Sure.
Because this stuff goes up into your brainstem. So if you happen to injure that area, it's not good.
Right.
But the data suggests that, they've done like some cool studies. I should have those studies pulled out, but they do like full range of motion challenges, and they look at the tensile strain on this vessel, and like stretching it and holding it into that position is actually worse than a quick light adjustment. So if you have someone doing like a big massage movement, they're doing like some ART and they're stretching that tissue, like that is actually more of a challenge for that specific structure than a chiropractic adjustment.
Sure.
There's another data point I looked at. The amount of adjustments that it would take to like create strain on this tissue is in like the 10,000. Like they looked at like cadaver, like they stretched it like that, and it started breaking down in like the upper thousands.
Jeez.
So
Yeah.
I mean, this is pretty resilient tissue.
That's interesting. I don't think I ever knew that.
Yeah.
And it's a cadaver too, so it's not live tissue.
Dead tissue.
So it's the elasticity's got to be different too.
Oh, right.
Right. So
But
the predictors for strokes like that are so crappy. So as clinicians, it's like worst and first, like we're not touching you.
right.
And there's people that would be like, okay, well, let's work on you either way.
Yeah.
And I think they come from a good place, like let's get you feeling better. But there is a moment to pause and
Yeah, there's
get things.
screenings.
Yeah.
There's screenings that we'll do if people have those certain signs, changes in vision, hearing,
Yeah,
like
if you-
other things too that we can analyze once they give us those data points. But
Right.
my point being is like, what's the most common reason people come to see chiropractors?
My
neck
neck
pain,
hurts.
headaches, same stuff. And, whether they go see a chiropractor or a medical doctor, like that's just, they're already experiencing the stroke. It's just depending who they go see.
And some of the studies that
going to fall into.
Some of the retrospective studies that look at past data, they'll have a questionnaire. It's like, did you have a chiropractic adjustment on the day that you had the stroke, a week, a month, or ever in your life? And so some of the data points they'll take, like, oh, this person went to a chiropractor in their life and they had a stroke. That equals.
Right.
So that's really unfair. Some of the stuff I pulled up a couple and I was like angry. I haven't looked at this stuff. I wrote in undergrad, I wrote an essay about like why you should go see a chiropractor. It was like a argumentative, there's a better word for it, but it was like a persuasive essay. And I said, you should go see a chiropractor first. And my teacher who was grading it, she was so against chiropractors. So it was like bringing up some of those memories because she'd be like, what's chiropractics? I'm like, you don't know? She's like, I'd heard they hurt you. I'm like, oh boy.
Yeah. Well, I mean, you're going to believe what you want to believe. You're going to then therefore back up that with whatever you can find on the internet to back up your own bias. And there's like very little that someone else can do to change your mind, whether that be a chiropractic or a political stance or whatever it might be. Right. Yeah. So it's like,
I usually say follow the money.
Well, you were talking earlier, you both are talking about the cost of a visit as versus what it would cost to have the end result, the possible end result of a surgery, right?
Yeah, financial end result, and then also morbidity rates per those treatments too.
Right. You can't spend money if you're dead. So that's something I always think about. But then if you really start talking about it, you're thinking about that one.
I was like, can I spend money after I'm dead?
I mean, your family could. All the money that I'm not going to leave them. But yeah, like it's not even in the same category if you start breaking it down. Like, it's going to cost me, boy, can I afford $500, over the next 4 or 5 months? Boy, I probably can if I think about the other option, which is a $30,000 knee surgery in 5 years, whatever it might be.
Yeah. Like a lumbar surgery, you're looking at 50 to 75 grand.
Yeah.
I mean, granted, like the majority of that cost is through your insurance. Like, thank you, insurance companies, for providing that type of care. Yeah. It was just like a heart surgery or anything like that. Like the, oh shit, like moments in your life, like you're going to mostly be covered. But, like patient out-of-pocket expenses, like we usually run into people with their deductibles being anywhere from like $1,000 to $5,000. We're like, we're probably not going to even get close to that.
Yeah.
Low number.
Right.
Like I was going to pull up our case average, but I know like what it is.
Yeah, you have a ballpark.
Yeah. Like for acute, like what we're submitting to insurance, which they define as like acute care, like we're trying to fix a symptom. This doesn't take into account wellness care for people who want to maintain where they are. We're around like 6.3 to 8.5, I would say.
And just so people understand what that number means, it means the per visits, the visits
per case. Right. So if Zach walked in with hip low back pain as a new patient, I'd be like, let's see you 8 times, but people generally get better before that. So our range is, let's say 6 to 8.
It's like the average.
So multiply that by, generally industry chiro adjustments, $50 to $75. Let's max it out to $100. Yeah. Like most people, like maxing out of pocket expense is $500 to $800 for acute care. And what that translates to, if you have a copay or coinsurance, it's much less. So it's
kind of a no-brainer.
It's a good place to start.
Yeah.
I think is like our clinical education too. Some people are like, oh, like you guys don't go to school as much as medical doctors. Well, we basically do. Like over 4,000 class hours are recorded for medical doctors. We're right around there too.
I mean, I have an uncle who thought it was like a weekend course that I took.
So, I mean, you can look at all those things too. And I mean, we both know how much it costs to become a chiropractor. It costs some money.
Yeah.
More than our insurance. Our malpractice.
You know what? That's actually a sickening statistic.
Yeah, it is. I'm like, oh, kind of depressed now. Like, depends what your definition of a doctor is, right? Like, can I prescribe you medication? No.
It's not in our scope.
That's it.
Thank God.
Yeah, there's a lot of stuff that we know. Like, we just stay within our lane. Like, if you got a musculoskeletal condition, come on in.
Yeah. Like when patients that come and they're like, well, I need to see a spinal doctor. I'm like,
yeah. Yeah. What do you think I'm doing?
What is this model here? Oh, wait, it's
what do you
Do you have one of these inside of you? Because if you do,
Yeah.
No, this is just my guitar. Oh, man. But I think people are, they hear stuff on, media sources, and they hear kind of crappy stories.
Right.
Quacker practice.
Like, it's like, I don't know, we just like to help people.
Yeah.
Like, we just happen to have our doctorate.
Yeah.
And we can legally do it. It's kind of cool.
Yeah.
I mean, but like you're kind of talking about medications too, and we were touching on stroke too. Like your increased likelihood of stroke just from taking NSAIDs. Like think like NSAIDs, ibuprofen, Tylenol, like stuff like that people just take like Skittles. Yeah, nonstop. And it's like, well, if you like you're putting yourself at higher risk from doing that and not seeing a chiropractor than you are like going to see a chiropractor and actually getting it fixed.
Yeah.
It's
don't get us started on the opioid crisis.
Please do.
Jeez. Well,
opioids are bad.
You hear that big farm?
Don't do opioids.
I read a little stat like there's 14 to 25% of people who like are prescribed an opioid will abuse it in some way, like unintentionally or intentionally. Sure. Like that is nuts.
Yeah.
That's just crazy. It's sad.
And like some of the studies and like the payouts that these pharmaceutical companies like, oh yeah, there was like 60,000 people that may have died because of this medication, and they paid a couple $1 billion out of their $13 billion profit. It's like, and then we get greased up for oh, I heard that chiropractors cause strokes.
Yeah,
that's something you did here, isn't it?
Yeah. Well, even on
juxtapose those positions.
You get into like the research behind some like medication research, how they construe numbers. Like different medications, they'll be like 66% improvement of symptoms, and it's like they take 3 people and
they all get diarrhea as well.
Like it's such a small population. It's just like how you can construe the
boy, my knees feel great, but
like,
I have to sit on the toilet a lot. Is it normal for anal bleeding associated with chiropractic adjustments? Like those you hear the commercials on TV and they just list through everything. And you're like, wait. What was that?
Yeah, what was that last one? I'm bleeding from my eyeballs.
Rectal discharge. I don't want that.